So I think inclusion body myositis impacts not only the person, but the loved ones around them. And so I've often seen relationships grow and sometimes not. So depending on those that you love becomes an important part of your long-term health. The lifestyle modifications are probably one of the most important parts of this strategy to live well with myositis, because there is currently no long-term option for pharmacologic or drug therapy today. So patients should be very aware of their surroundings with regard to potentials for fall. Minimizing, for example, changes in terrain from carpet to a hardwood floor can be a simple fix to just be very careful and anticipate, trying to minimize their chance of falling. Watching their food choices and being careful in that regard with regard to any swallowing problems. I think it becomes a strategy to be anticipatory rather than reactionary. In other words, anticipating if they should need to go out to an event for possible issues regarding stair climbing, etc. So planning ahead, making sure someone is there for assistance if needed, or being able to strategize trying to avoid stairs or any obstacles that might make it more difficult for them to navigate going out, for example. And then finally, maintaining an active lifestyle every day. I think the thought is that when one has a muscle disease, maybe perhaps resting the muscles would be important. And in fact, that's the old paradigm. We used to say as soon as you were affected and your muscle enzymes were elevated, that must mean that you should rest. In fact, the opposite is true. In our experience, the patients that do the best seem to be those that exercise daily and consistently. And that includes the upper body and the lower body on a daily basis. Enlisting the help of your spouse or partner or sibling or someone close to you in that effort, keeping you accountable, is probably one of the best strategies for maintaining regular exercise and extending the longevity of your muscle as long as possible. I think the best strategy for caregiver education are our partners like the Myositis Association and patient advocacy groups. They are present on a national level and on local levels. And I think finding folks who have and share the same story probably provide some of the best benefits for feeling like you're not alone. And I think recognizing and going head on into the illness and its long trajectory, likely years with this illness in a slow fashion, is important to discuss with those you care about. The other things that we ask patients to do are maintain a healthy diet, good amount of protein sources, and there are some vitamins that some people recommend. However, I always tell the patient that certainly you can try them, and probably the only risk to you is to your wallet. So because the studies are really small and not necessarily conclusive, while there is likely no harm in trying them, you may in fact be paying out of pocket to try a vitamin source that may not in the end be helpful. The other thought is creatine, which is a muscle supplement to help with muscle bulk. Again, limited data, but some patients do find this helpful, and once again, we find little to no harm. There just may be no long-term benefit. I always tell patients to give it a 2 to 3 month trial on average, and if it doesn't work after that, to stop it.